Callie Smith. Today I'm here to talk to y'all about improving patient outcomes in postpartum hemorrhages. What is a postpartum hemorrhage? Postpartum hemorrhage is typically defined as estimated blood loss of more than 500 milliliters after vaginal birth or more than 1,000 milliliters after cesarean birth. Postpartum hemorrhage is a life-threatening complication of childbirth, the most significant cause of maternal death worldwide. Of the 80% of maternal deaths that occur within 24 hours of delivery, postpartum hemorrhage is the most common cause. These are pictures of placenta. It just shows you how much on a lap in delivery looks like measured out on the lap. Classifications of postpartum hemorrhage. Primary hemorrhage occurs within the first 24 hours of delivery. It's usually caused by uterine atony, retained placenta, or lacerations that aren't seen and aren't repaired. Secondary hemorrhage occurs 24 hours to 12 weeks after delivery. Possible causes are subinvolution of the uterus, retained placenta, infection, and inherited coagulation defects. Uterine atony. Muscles of the uterus do not contract after delivery. Causes of this could be full bladder, excessive manipulation of the uterus, prolonged labor, multiple pregnancies, and overstretching of the uterus, such as twins or a large baby. This just shows you how to massage the uterus, manual fundal massage to help get the blood out if the uterus does have uterine atony. Retained placenta. The placenta or fragments of the placenta may adhere to the uterine walls, therefore preventing the uterus to contract. This can be caused by manual removal of the placenta or placental accreta, which is growth of the placenta into the muscles of the uterus. Lacerations, tears of the perineal tissues occurring during childbirth in the labia, perineum, uterus, cervix, or vagina. Causes are spontaneous vaginal delivery and delivery of a large infant. Preventing hemorrhage. The main thing you want to do is assess the placenta. When it comes out, you want to make sure it looks as whole as possible. The nurse or the doctor will assess the cervix, the vagina, and the perineum right after delivery to check for lacerations or any kind of excess bleeding. Monitoring vital signs after delivery, doing a pad count with each patient. Up here on the postpartum unit, we have a scale in the soiled utility that we can use to measure the pads and measure the linen if the patient does have bleeding to get an accurate estimated blood loss. Fundal massage every 30 minutes for the first 2 hours after delivery, then every hour for the next 4 hours, and then every 12 hours until discharge. A hemorrhaging patient, these are some of the signs and symptoms that you'll see in the patient. Pale skin, fast heart rates, fast respiration, low blood pressure, low oxygen saturations, the patient complaining of feeling weak and feeling the gushes of blood. Administration of postpartum hemorrhage medications. You start by administering postpartum Pitocin. Next, you would administer Methergin in an IM shot, and then if Methergin doesn't work, you then go to Cytotec. Pitocin you can give IV or IM, depending on if they have IV access or not. Methergin you give IM every, it takes about 7 to 15 minutes to start working, and it lasts about 3 hours. And then Cytotec is 800 to 1,000 micrograms rectally. It onsets about 3 to 4 minutes. The implementation of assessment for, you want to assess blood loss. You want to assess the vital signs every 10 to 15 minutes to make sure that the blood pressure is not dropping. Their two sats are good. You want to maintain IV access. You want to administer IV fluids to help with the blood loss. Assess for pain because you're going to be doing the fundal massage a lot. So you don't want them to be extremely uncomfortable while you're doing that, especially your C-section mamas. Perform uterine massage using both hands. Maintain or insert urinary catheter if you need to. If the patient can't get up and void. Administer uterotonic medications, apply the pulse ox, and administer oxygen if you need to. Elevate the patient's legs 20 to 30 degrees in the air to help with put them in Trendelenburg position. It helps to take the blood to the heart and the brain. Special considerations, you can also use an ultrasound to help diagnose retained placenta. If the patient's bleeding and you can't get it to stop with medication or anything, you may want to look and see if there's something the doctors may have to go back in and remove it manually. Dilation and curettage may be necessary if the ultrasound reveals retained products of conception. Oxytocin alone is the treatment of choice for postpartum hemorrhage if the patient didn't receive oxygen during the third stage of labor. If the patient received oxytocin during the third stage of labor, all the receptor sites fill up, and so if you keep pumping them with oxytocin, it doesn't pick it up. They're full, so there's no need in pumping them with it. Calcium gluconate, 100 to 1,000 milligrams IV may be indicated if the patient has been receiving magnesium sulfate. Any questions?
Very good. Very informative.